Autism and biomagnetism. Autism is a special neurodevelopmental condition. What characterizes people with this condition is their peculiar way of perceiving their environment, presenting problems of communication and social interaction. The person with autism spectrum disorder tends to perceive reality in a different way, generally directing their attention more towards a subjective world and withdrawing it from the environment and from people. They tend to focus their attention on particular things or specific details and have a hard time capturing the full picture of their environment. For example, they can get caught up in observing details of a small object or the shadows on a surface. They may have restricted and repetitive patterns of behavior, such as repeating movements, sounds or phrases. Going outside of these patterns can cause panic attacks. People who suffer from this disorder in a more acute form isolate themselves almost completely from the outside world. So from a young age they do not achieve normal language development or have difficulty carrying out common tasks, without actually suffering from a psychomotor disorder. While those with moderate symptoms, such as those previously known as Asperger syndrome, are able to integrate into social groups such as family, school or work. However, in most cases they are seen as strange people, due to their way of speaking and behaving. Their language is usually very literal, with little ability to understand jokes and figurative language. Their body language is not very expressive. The autistic spectrum is difficult to diagnose as it can be confused with other mental development disorders. Currently, the autistic spectrum is classified according to the degree of help that the person requires. Level 1, moderate help. Level 2, significant help. Level 3, very significant help. Autism has an incidence of less than 3% of the population worldwide. Previously, it was thought that it affected more men than women, but it has now been discovered that it actually affects both sexes almost equally, only its manifestations are different. The causes of autism are not entirely known and have been attempted to be explained from different approaches. Emotional factors such as a lack of affection or a hostile environment in early childhood may contribute, although they are not considered the main causes. The theory of executive function disorder explains why these people have difficulty performing ordinary tasks such as those related to personal hygiene, going to school or work, maintaining social ties, etc., skills that are controlled by the prefrontal lobe of the brain. Autism may be due to a congenital condition that results in abnormal brain development from the formation of the fetus. Jacobson syndrome is a disorder of chromosome 11, or chromosome 22, which can facilitate the appearance of the autism spectrum. Currently, more than 100 genetic markers related to autism have been identified, so epigenetics also plays an important role. In conclusion, autism is most likely the result of several of these factors, and not just one of them. There are some psychological aspects associated with autism that we must take into account, such as the tendency to depression and apathy. Sleep disorders such as insomnia may also occur. The autistic person also tends to suffer anxiety or have repetitive, obsessive-compulsive behaviors. They may also present attention deficit syndrome. The tendency to isolation must be taken into account, which in many cases causes rejection by social groups, especially in school environments where the child may suffer bullying. On the other hand, autism affects the physical plane to a lesser extent. Gastrointestinal disorders may be due to the associated stress and anxiety, while seizures are due to disorders of the nervous system. Biomagnetism, as in many other disorders, can be applied without any risk as the possibility of achieving important changes in the affected person. Before listing the pairs, we must clarify that no two autistic people are the same. Each will present different levels with their particular strengths and challenges, so a general protocol cannot be given, but rather specific pairs for each case must be found. starting by testing the ones presented below. Pole, calcaneus, is generally a pair that we can apply to every person with autism. Parietal, it is applied especially when the person suffers from depression and/or apathy. Vagus nerve, kidney, it provides balance to the nervous system, reducing stress and providing greater emotional balance. Pancreas, is applied in case of mercury poisoning or poisoning by other heavy metals, possible causes of autism. Quadriceps, is applied when language disorders are observed. These pairs and some others found in the biomagnetism guide can be applied, see link in the video description. Advanced biomagnetism may also use bioenergetics and other tools to treat this complex disorder. In addition to biomagnetism, it is advisable to try other tools such as behavioral therapies focused on the challenges to be overcome. Music therapy can help you to contact and express your emotional world, while play therapy sessions can lead you to expand his interests. In particular, play therapy and imitation exercises can facilitate the development of mirror cells, the development of body language, and therefore translate into better social integration. Language development therapies will be applied when these types of problems arise. Medications such as antipsychotics can only be prescribed by qualified physicians, psychiatrists. Let's remember that autism is not a disease, but rather a condition, so we cannot talk about its cure, but we can treat the associated symptoms and provide a better quality of life for the person. In the case of a girl or boy, we can facilitate better development and social integration. In the description of the video you will find links to useful pages for parents, teachers in general, people who treat children and people with autism. We hope that this video has been of interest to you. We appreciate that you like this video and share it with anyone who may find it useful. Thanks for watching this video.